We would like to know what exactly are skin boosters.
Basically, they are improve the skin texture and the hydration level of the skin.
Nobody wants to look old. People want to look young for a very long time now. So can you please explain to our viewers what skin tightening is exactly all about?
Yes. So nowadays the world is moving towards regeneration. The basic and the most simplest regenerative technique what we had for several years.
Let's talk about social media trends. Skincare these days is really a trend. What should be an ideal skincare for today's time?
These are unrealistic expectations.
What laser hair removal therapy is all about, whether it is safe for everyone or not.
If you take a sizable number of sessions, there is approximately 70 to 80% reduction in your hair count.
If I have to, for my skin type, if I have to opt for a particular non-surgical treatment, how do I decide which one to go for? Welcome viewers to yet another episode of the Health and Happiness podcast presented by SastaSundar. We have got a great response on all our previous skincare and hair care episodes. So here we are again with another episode on dermatology. Today's video is sponsored by Lupin. For years, Lupin has been a dependable skincare and hair care partner for all of us, and it caters to all problems related to skincare and hair care. Lupin's product line is available on the SastaSundar app, so do check out the SastaSundar app for all Lupin products. Today we have Dr. Somodyuti Chandra, who is a renowned dermatologist of Kolkata. She has over a decade of experience and is associated with renowned clinics and hospitals. Welcome to our podcast, Dr. Chandra. We are honored to have you here today.
Thank you so much.
So let's start our conversation with skin boosters today. We would like to know what exactly are skin boosters.
So basically, skin boosters are molecules particularly comprising of hyaluronic acids as well as some additives which can be added to the hyaluronic acid which forms the base. They are injected very superficially into the skin to boost its texture, elasticity, and radiance. So that is why they are called boosters. So basically, they are to improve the skin texture and the hydration level of the skin. So anybody wanting a quick recovery from the skin dehydration and skin dullness, they can opt for this treatment.
Great. So let's say for a layman like me, if I would want to opt for skin boosters, where should I start?
You should actually start from a good skincare regime. So, when we talk about treatments, they are always added to your normal routine. So, that is not a comparison. Okay. So, first we have to take care of your normal routine. Then we have to boost it. So, as the skin booster goes, it is not a one time treatment. It is not one thing which will solve all your skin concern, but it will definitely add value to the skin texture, hydration, and overall quality of the skin. So, if you are not maintaining your skin, you will not see the quality change. So, that is the important thing. So, that is where you should start your journey of a routine skincare, and then the skin booster comes.
Right. We would also like to discuss about all the non-surgical treatments available in the market today. So if I have to, for my skin type, if I have to opt for a particular non-surgical treatment, how do I decide which one to go for?
Okay, so non-surgical treatment is a huge subject, I would say. We dermatologists, we mostly deal with non-surgical, non-invasive or minimally invasive treatments, which are very comfortable to the patient. They mostly don't have downtime. Even if they do, they have just a few days, maybe maximum 4 5 days of downtime. So most of the treatments what a dermatologist or does, they are non-surgical or minimally invasive. Okay, so now just to simplify, there are various types of treatment depending on somebody's skin concern. So like if I go on to explain it in detail, like if somebody's concern is more of pigmentation, so what are the treatments are there? Most simplest treatment is microdermabrasion, hydrofacial, peels, chemical peels, lasers. So these are the most simplest treatment to take care of the pigmentation aspect. Now, if somebody's concern is more of scar improvement, they have a scar, they want to improve it. So yes, we do have some simple treatments to improve the scars, like microneedling, like PRP, like lasers, like the fraction lasers, like microneedling radio frequency, which is popularly known as MNRF. So these are the things which takes care of the scar management, which also takes care of the open pores, a little bit of sagging, skin tightening, neck skin rejuvenation. So with aging, not only our face skin gets loose, lax, or wrinkly, it is also the neck area, the skin in the neck area actually is very prominently shows the wrinkling effect and the crease lines. So MNRF is a very good treatment for neck rejuvenation. Now we talk about non-surgical skin rejuvenation in terms of taking care of the wrinkles, the sagging, the prominent lines or expression lines. There the Botox comes into play. The Botox helps to take care of the forehead wrinkles, the wrinkles around the eyes. Also we use Botox to slim down the face. Okay. And of course there are fillers to take care of a volume loss, to take care of gross sagging. There are non-surgical skin tightening devices nowadays available, very safe, almost negligible downtime. Somebody who is very wary of needles, they can have great results. Of course, number of sessions are more for them, but they can have great results even if they don't want to go under the knife or they don't want an injectable treatment.
All
So.
right, great. So, like, ma'am, you already mentioned about skin tightening. So, it has been gaining popularity over the past few years. Nobody wants to look old. People want to look young for a very long time now. So, can you please explain to our viewers what skin tightening is exactly all about and how do we start skin tightening procedure?
So I would just want to reframe the question. We don't need to look young. We just need to look our age. We don't have to let our like the people know how old are we. So that is more important. You will never look like somebody else. You will never look like 20 years younger or 30 years younger. These are unrealistic expectation, but we can definitely look the best version of ourselves for our age. So that is the most important, and that is what we can do, and that is what is achieved. So when we talk about non-surgical skin tightening devices, there are many modalities which actually are employed to get that tightening effect. For a basic thing, when we are talking about tightening effect in the skin level, so we just have to just understand there is skin, there is just below the skin, there is a subcutaneous tissue or the fat layer. We know that just inside that or just below that there is a muscle layer. So when we age, when the aging changes occurs, it is all these layers including the bone which undergoes a series of changes. And when we talk about regaining or retaining my old framework or my old volume or my old lift, I have to reframe each and every layer so that I get a more holistic and a better structured and a well balanced outcome. Understood? So when we are talking about regenerating in my skin level, or particularly regenerating the skin around the eyes, we have microneedling radio frequency. We have other radio frequency devices which actually produces collagen by needlework. So there are multiple needles which enter your skin, and with the radio frequency energy, which basically stimulates more collagen, the regeneration of the collagen occurs like that. When we talk about redefining the jawline, making the jawline sharper, maybe taking care of the double chin area, there is something called a HIFU. So these are ultrasound based devices. The full form of HIFU is high intensity focused ultrasound. So that is employed to tighten the tissue, to texturize the tissue, to make the tissue more balanced, uh, more structured, and excessive fat and pockets of fat can be taken care in this with this device. So, these are the majorly the non-surgical devices we have to for skin tightening.
Great. So, like we were talking about skin tightening devices, we've also heard that there are a lot of regenerative treatments available these days, like light therapy, mesotherapy, etc. So, can you please explain to our viewers what are the different kinds of regenerative treatments available and whether or not these treatments are applicable for both skin and hair?
Yes. So nowadays the world is moving towards regeneration. So the basic and the most simplest regenerative technique what we had for several years is PRP, or platelet rich plasma. Nowadays we have an advanced PRP or PRP-GFC, or growth factor concentrate, which is added to the PRP. So that is kind of a next gen PRP, I would say. So these are the main motive of these therapies are to stimulate the stem cells for and stimulate the regenerative cells, put some signal molecules for more collagen synthesis in terms of your skin, more firming effect. And for hair, it is the regeneration of the follicles. They also improve the microcirculation in the scalp, and they prevent hair shedding. They stimulate more regrowth. So these are the main functionalities, or their mechanism how which they actually benefit us. Now when we talk about the skin, so of course PRP is there for both skin and hair. Advanced PRP is also available for both skin and hair. Apart from facial skin, we also have other body areas. Actually, people have become very, very thankfully conscious about taking care of the other body areas, particularly the neck area, the hands, etc., which is subjected to a lot of wear and tear. Now, one of the most advanced, very recently launched treatments for non-surgical improvement of both skin and hair, they are exosomes. So exosomes currently has become the buzzword. So they are basically molecules, the signal molecules in a vesicles, which are they are prepared already, and they are again applied to the skin after light microneedling, and it has been found that they regenerate and have a better and a lasting effect. So these are some new treatments which are available. Light therapy, you have rightly mentioned. Light therapy, particularly the red light wavelength, red light of around 630 nanometer, they have been found to enhance the hair follicles, and they have been found to have a photobiomodulation effect. So what is that? I mean, of course it might sound a little tricky, but it reduces hair shedding for any person who has suffered from a shock loss. I mean, stress induced hair shedding, a lot of hair shedding. Hair shedding has become the a different type of pandemic nowadays. Everybody is suffering from hair related some problem or the other. So red light therapy is completely non-invasive and even can be done at home. So there are home based devices as well, which you can talk to your doctor about it. They can he or she can guide you about it, but it can be also taken at home on like twice a week or thrice a week basis, and it reduces scalp inflammation, reduces scalp inflammation and scaling and irritation, and in the long run improves the microcirculation to the hair follicles, thus improving the hair structure, the hair tenacity, as well as hair regrowth.
That was a really insightful answer, doctor. So let's talk about another very popular therapy these days, which is the laser hair removal therapy. A lot of people are doing it, and a lot of people are scared to do it because the laser word is there in that therapy.
True.
So I would like you to explain to all our viewers what laser hair removal therapy is all about, whether it is safe for everyone or not, and how do we start this therapy.
So, laser hair reduction is the correct word. So, why not removal if you ask me? So there are, if you take a sizable number of sessions, which is something around 6 to 8, there is approximately 70 to 70 80% reduction in your hair count. Hair count means hair density as well as the hair thickness. So the hair thickness gradually changes into a very fine hair. So thick hair changes into a thin hair. That is the basic thing. Why not zero? Because zero is an absolute number. In any kind of medical service, you cannot assure 100% result. Every human body is different, and hair is something where if you get a cut, from where does the cells come? It is the stem cells in the hair follicles which cause the regeneration. So zero is not the target. The correct word to be used is laser hair reduction. Now, if it is not zero, then why should people take it? So the actual why we do it, we do for hair which are thick, which are cosmetically disturbing for you. We do a laser for a safe, without side effect, and a long lasting change of the thick hair to a thin, cosmetically acceptable, and even cosmetically non visible hair. So we all know we have hair on our face, like the cheek area as well, but it is not visible, right? Why isn't it not visible? Because it's very thin. So the main purpose of doing a laser hair reduction is to change a thick hair which is cosmetically disturbing to a thin hair which is not visible. Now, for laser hair reduction, most areas of your body can be done, most areas, and it is equally acceptable to both the genders. Currently, men also do laser hair reduction for areas like unwanted hair in their ears, beard shaping, etc. So we have patients demanding for it because they don't want these regular shaves, cuts, folliculitis. There is post shaving bumps, etc., etc. They do not want to go for it. Safe, of course, yes. Please get it done in a dermatological clinic, not in a salon, spa, or allied place where it is not assisted, not supervised by your doctor. So if you are also ensure that it, because it's a machine thing, right? So there are two factors which is involved in your efficacy. One, the quality of machine. Of course, it's a machine work. Number two, the operator. So the operator has to be skillful. The machine has to be good.
In short, we need to do it only at a dermatologist.
So these are dermatological based services and should be done under those kind of environment.
Right. Supervised by a
Supervised,
dermatologist.
definitely.
So, ma'am, a while back we were discussing about regenerative treatments, some of which are also applicable for hair. Now, a very popular therapy is hair transplant therapy these days. So, we would like to know, how are these regenerative treatments different from a regular hair transplant?
True. So by hair transplant, we mean we take follicles from a certain area and we plant it in a different area where there are no stem cells, or the stem cells are so weak that they are not in a growing phase. So we do not have follicles which can be triggered, which can be stimulated for regrowth. So if you do not, it's like, let us understand uh, by analogy, where we are comparing our scalp to a land of uh, with trees, right? So if we do not have seeds, and if you go on putting fertilizer, will I have a tree? My answer is no, right? Now if I don't have seeds, how will I grow hair over there? So for that kind of land, I definitely have to prepare my bed, my land, my soil, have to ensure the other conditions are appropriate, and I have to put seeds or small saplings there. So this is the difference between a hair transplant, and why, even if you are taking a hair transplant, the other medical management, both in terms of lotions, some tablets, and these kind of regenerative medicine should be added to the therapy, but the transplant is a different thing. So transplant means I do not have follicles there. I have to put some follicles into that barren area, and then you stimulate the follicles for better regrowth.
Great. All right. So let's talk about mold removal. A lot of people are opting for mold removal these days. So is mold removal really safe, and how is it done really?
Mole removal again is very, very safe. For mole removal, there are two types of treatments, one surgical, one is non-surgical. So with the advancement of lasers, and there are safer options of lasers do have come a long way in managing most of the moles. Now, why did I say most and not all, if you might ask me? Then mole, whether it's removed surgically or non-surgically, will depend on the type of mole. Where is it placed? Whether how what is the depth of the mole? So if it is a small mole in a site where and it is completely flushed, it doesn't have a depth, it can be very safely removed with a laser without any scar, without any after effects. Now if it is a big mole, it is of a large size with an overlying hair follicles, etc. So these kind of moles, these are called common melanocytic nevus or congenital melanocytic nevus. So they are better dealt with a surgical approach, surgical removal followed by suturing.
Major lifestyle disorder these days is PCOD. And due to PCOD, there's a lot of acne and pigmentation in a lot of women. So, how do we treat this acne and pigmentation which is induced by PCOD?
Now, PCOD or PCOS, which is very commonly called, it is not a disease or a disorder. It is a conglomeration of various signs and symptoms which your body is undergoing because of a hormonal change. Okay, so this is in short of it. So there are no specific signs, means every PCOD patient is unique in its type. Yes, because of these hormones, there are a lot of skin related effects, that even hair related effects, that is visible, like increased oiliness of your skin, both skin and hair actually, increased incidence of dandruff in these patients, deep seated, painful, recurrent acne problems. Mostly people suffer from nodulocystic variants of acne, or maybe pustular acne, and that just refuses to go with the standard modalities of therapy. Unwanted hair in a female body, particularly on the facial areas, but of course it can be on the other body areas as well, like the chest, like the abdomen, and various other areas. So these are thick hairs, uh, needing removal of some kind, because it is completely like a male patterned hair on a female body. They also suffer from something called an alopecia, female pattern hair loss. So it is huge number of signs and symptoms are encountered in these patients. When we talk about pigmentation, yes, there are not a different type of pigmentation altogether in these kind of PCOS or PCOD patients. They are called insulin resistance induced acanthosis nigricans. So you will find there are many patients who suffer from darkening of their neck, their underarm area, or even their inner thigh area. So these are not dark in terms of pigments. They are not pigment deposits. So what happens is, because of insulin resistance, the insulin level in their body is quite high. So this triggers thickening of the skin in some parts of their body, particularly the neck area, the underarm area, the inner thigh area, and even it can occur to any other crease area and also the face. So they are not pigment. So the modality of management of these type of pigmentations are completely different, and it has to start with lifestyle modification and some techniques that will take care of the insulin hypersensitivity, then and the modalities that will take care of this epidermal thickening, or the thickening of the skin because of layering, or because of increased insulin, and because of increased secretion of epidermal growth factors. So pigmentation is different types in these patients. Also, even uh, increased seborrhea or so-called oily skin. Even if somebody suffering from a very oily skin will also experience patchy pigmentation, just like we see in terms of open pores, somebody having open pores, or somebody having blackheads and whiteheads. So the black spot of the head is the comedonal opening or the sebum opening. So if you have a lot of sebum, those patients also suffer from a seborrheic melanosis and different type of pigmentation. So in terms of management of these kind of patients in a background of PCOS, is first starts with lifestyle management. If they lose weight, if they have a better hormone control, without very specific management of the dermatological aspects, much of their symptom improves. Of course, there are other modalities to take care of it, but yes, it is a kind of a multidisciplinary approach.
Right. To sum it all up, I think lifestyle modification is the basis of everything.
Of many things.
Many things. All right. So, ma'am, let's talk about social media trends. Skincare these days is really a trend with the advent of social media. There is a host of products available in the market. People do not have the correct information about skincare or hair care. Since you're an expert, we would like to know from you what should be an ideal skincare and hair care for today's time.
The basic minimum thing to maintain your skin is cleanse, moisturize, or hydrate, and protect. These are the basic. This has got no gender or age differences. So, whatever may be your age, you should use a specific cleanser for your face, a different body wash for your body. Simple as that. Moisturize depending on your skin type. If you have extremely dry skin or maybe sensitive skin or more demanding skin, you should use a ceramide based moisturizer. Frequent application of moisturizer is important depending on your lifestyle. Means if you are in an environment which is very dry, particularly long hours in office with a corporate job with a lot of AC, you need to reapply your moisturizer to take care of your skin barrier, followed by sunscreen or sun protection. Now, sunscreen is a UV protectant, and we all know that sun is not the only source of UV light. Indoor lighting also plays a havoc to your skin health, so we must protect it. It is not only for your face, it's also all for every exposed areas of your skin. So this is in summation the basic, if you say. Now, if you say that what I want to add things to take care of my specific concerns, then specific serums, creams can be added to this basic platform, and that should be guided by your doctor. Of course, you can experiment, but then the word is experiment. If you want a guided approach, please consult your doctor. If you're talking about hair care, basic hair care routine should be cleansing, followed by fixing the hydration. So for cleansing, please use a shampoo depending on your scalp type, because hair length is mostly on the drier side for most people. So whatever is your scalp type, choose your shampoos accordingly. Try to restrict the shampoo use to your scalp more than your hair. Post wash, use a conditioner for the length. Wait for some time, let your hair be semi-dry, and then use a serum for the length and then brush. So this should be good enough for most people.
That was a great advice, doctor. And it was a great conversation, Dr. Chandra. We had a lovely time talking to you. Thank you for being on our podcast. Thank you to our viewers for watching the Health and Happiness podcast. If you have questions regarding skincare or hair care, you can write to us at podcast@sastasundar.com. You can also comment in the comment box. Do not forget to like, share, and subscribe to SastaSundar's YouTube channel. Please download the SastaSundar app. You get 100% genuine medicines over there, 18% discount, and a free home delivery. Thank you for watching our podcast. We will see you in our next one.